So we're from Pathways Counseling Services. We're about a mile and a half away from here. And I'm going to be talking today a little bit on EMDR and talking about what it stands for, what it is, why we use it, and so forth. It's a type of treatment that we do. And Valerie is going to be talking a little bit more about hypnosis and how it can apply to everything, and kind of talking about the myths behind it and so forth.
That's right.
So, good. Okay, so I'll start. I wanted to hand these out. This is just a little handout that we have about what we're going to be speaking about. We do more than EMDR and hypnosis, but these are two of the treatments that are commonly, asked for, and that we do a lot of. We were also featured in a magazine this past month, so feel free to take a copy. I brought a lot, so I didn't know how many people were going to show today. So yeah, I'm going to talk to you a little bit. Is anybody familiar with what you do know? Okay. Have you seen good results from it? Or great. Okay. It stands for eye movement desensitization and reprocessing. So it's a bit of a mouthful. I am trained in it, and Valerie is as well. So we use it a lot in the practice. I use it with probably about 80% of the patients that come in to see us. Originally, it was really a trauma treatment. And so they use it a lot in the VA hospitals with the veterans for PTSD. However, they have found that it is very effective with all types of things that people are coming in for. So it is the number one thing that I have seen or used for anxiety disorders. So anxiety disorders, it's a bit of an umbrella. Anxiety disorders, there's a lot that falls under it. There's panic attacks, there's phobias, there's OCD, obsessive compulsive disorder, there is generalized anxiety disorder, just you name it. But EMDR is very, very effective, so we use it a lot for that. It can be used with children, it can be used with adolescents, it can be even used with infants. I did a training with that they do it on infants, which is pretty amazing. So
why would they do it on infants? They haven't had trauma yet.
Well, they believe that infants can experience trauma in utero.
I know. I'm going, what?
Yeah. When the mother is traumatized when she is pregnant with the child, they believe that that over time will affect the child later on, and that the child actually
transfer.
Yeah, and the child actually can have memories, and it's fascinating. It's really fascinating, and it actually works with children and infants. So it's very effective. I have not used it on animals yet, but I'm gonna maybe try that out on my parents' dogs and see how that works. But just to back up a little bit, there's a little bit of a myth around what a trauma is. So I like to talk to people about what trauma is and what trauma may not be. Trauma comes in all shapes and sizes. So trauma can be, your parents earlier, in life, mom saying, that's not good enough, or dad, always constantly, complaining about what you're doing or what you're not doing. It can be something that we normally think is trauma, kidnapping, rape, mugging, somebody goes to Vietnam or war. That's what we kind of picture trauma to be. But trauma can be, I've had people come in, I can't tell you how many people I have worked with that their negative belief about themselves is that I'm not good enough. And that stems, their first memory was PE, not being picked for PE on the team, being picked last for PE. I cannot even tell you how many people come in for that, and that is the first memory that we start working with. What happens in life is as you go through life, that becomes almost like a snowball. So imagine you are picked last for PE, and you think to yourself, gosh, nobody wants me on their team. I'm not good enough. And then the next year, Susie doesn't want to be your friend. And you think, boy, she's not friends with me, but she's friends with Allison. Must be because I'm not good enough. And then your teacher yells at you and gives you detention because you were chewing gum in class. And you think, wow, she didn't do that to Allison. I'm not good enough. And it snowballs and it snowballs. Instead of seeing it factually, you see it through your lens. So what EMDR does, and cognitive behavioral therapy as well, which is something we do, but I have had the best success with EMDR and dispelling those types of negative beliefs about oneself. So we all kind of have them. We all have negative beliefs about ourselves. So it may be, I'm not good enough. It may be, I'm a failure, I'm inadequate, I'm powerless to change the situation. And over time, we begin to believe that. And over time, if we don't do something about it, it leads to disease. So I have a lot of clients that come in with cancer of all types, and the doctor says you need to do something about your stress, your anxiety. It leads to disease in the body. It leads to depression. It leads to anxiety. It leads to weight gain. It leads all types of things. So this is a bit of a tune-up for your brain. These automatic negative thoughts, what we call ants. So Dr. Amen in Newport Beach calls these ants. And they're automatic negative thoughts. I see you nodding your head. Have you heard of him?
No, I'm just thinking that's a very good acronym. I mean, it has.
He's wonderful. If you ever have a chance to look him up, I have, he's a psychiatrist, very famous, well-known one from the Amen Clinic in Newport Beach. And I brought a SPECT image of the brain. And I'm going to pass this around so you can see this. There's a lot of research behind EMDR. And I'll explain this in a minute, but he basically, this is from his clinic. But these ants, basically, he says, we need to kill these ants. So these ants come at us, and they're automatic negative thoughts. And we need to stomp them out. We need to kill them. So one way to do that is through cognitive behavioral therapy, where we identify the thoughts behind the feelings. So oh my gosh, I'm up here. I feel nervous. My hands are sweating. My heart is beating. What's going on? Oh wait, I'm giving a presentation. So therefore I'm nervous. Okay. Now he says you need to challenge those thoughts. That's cognitive behavioral therapy. We need to challenge that. Well, I did a talk last week and it went really well. So you know what? I'm okay. I can do this. That's one way to challenge it, but that takes sometimes a very long time to actually believe those challenges. Another way that I have found very successful, and Valerie has too, is EMDR. And that's where I'm going to talk a little bit about EMDR. So that's the eye movement desensitization and reprocessing. And how that works is it basically reprocesses these negative memories. So to speak, it reboots the brain. It's like the computer has some viruses and it gets in there and it reboots your computer is what it does. So you have these automatic negative thoughts, and what EMDR does is it reprocesses these memories and these negative beliefs in the right and left hemisphere of your brain. So the first session would look very much like we would do an outline together. We go through what we're going to work on first, second, and third. After we do that, we also we give you something called a safe place. So that's a place where it's a resource, so that if the session does become emotional, you don't walk out feeling, like you stuck your finger in an electric socket, because it can be emotional. We're talking about emotional things. But as we go through the outline, what happens is a certain part of your brain lights up. And then in the right and left hemisphere of your brain, after we put the machine on you, it reprocesses that so that it's no longer a trauma. And I say trauma because, again, it's either a big trauma or little traumas, but a trauma is a trauma. And so it becomes more of an adaptive type of thought process. So if before you did EMDR, you didn't get that promotion, let's say, and you thought, oh, it's because I'm not good enough. That's why. It's that old thing coming up again. I'm just not good enough. After EMDR, it would look like you may say, I didn't get that promotion because Susie over there speaks 2 languages and they wanted a bilingual person and I am not. So you see how it would shift. Your thinking would shift from I'm not good enough to, well, I don't speak Spanish. And it's happened so naturally. It's a very organic type of shift. It's not something that you have to buy into. It just happens. So over and over, people say, I feel lighter after EMDR. The things that bothered me before don't bother me anymore. I hear that over and over and over again. It's really the quickest, I think. I don't know if you've experienced that, but I have seen results in as little as 1 session. So sometimes people can be a little bit nervous going in, which is really understandable because, they're not sure what to expect. And we're talking about emotions, and emotions are scary. So it can take a little bit longer if that's the case. And with childhood trauma, it can take a little bit longer because we go back a little further. I worked on somebody a little girl that choked on a chicken nugget at her school, and she stopped eating solid foods for 2 months. She started losing her hair, and she wasn't eating any protein. She was scared to death to swallow, and it took 6 sessions, and she was eating steak. She was eating everything again. So her parents were ecstatic. So that didn't take very long because it had just happened 2 months previous. But if it happened, 40, 50 years ago, it takes a little bit longer, but it's very effective. So I'm going to explain this. This was from the Amen Clinic, and as you can see, this top image is before EMDR. So where all of the red regions lie is where dysfunctional behavior is. So there's depression, there's sadness, there's anxiety. So all of the red, this is a SPECT image of the brain. This was before he started EMDR. So it talks about anxiety, panic, conflict avoidance, irritability, depression, negative thinking, all of that. The middle image is the same brain, but it's during EMDR. So as you can see, it starts to shrink. The red's getting smaller. And the bottom image is the same brain, but you can see the red really, really has shrunk. That was after EMDR. So this was just a common response to what this person witnessed. So I believe this person was a police officer and witnessed a shooting or was involved in a shooting. So that person's never going to like it. So that's probably where the red still lies. When they think of it, they think, oh, that's hard. But it doesn't traumatize them like this one did. It doesn't keep them awake at night. It doesn't have you can give them flashbacks, and they're not isolating anymore, things like that. So yeah.
How many sessions from the top to
That
the
I
bottom?
don't know, but I don't know specifically this person, but what I can tell you from my own experience, and I've been doing this a really long time, doing the EMDR, everybody's very different, but again, some people show symptom relief with as little as 1 session. The thing with EMDR is you want to follow through the outline that we do initially, because if you don't, I liken it to an antibiotic. It can come back a little bit and bite you in the butt. So if you don't, we have a specific outline for a reason. There's a bottom part where we install the future template, and we really want to get that in there. And then we do an assessment to see where you're at. And when you don't need it anymore, we say, great, and you feel it. You know. Yeah, but that's a good question. But some people notice the relief right away. It just gets better and better and better. It's like some bricks have been lifted off your back. So yeah. So does anyone have any questions? Any questions?
You mentioned a machine. What happens when you have an EMDR session?
Okay, so when you come in, we would start with the safe place. So we would that's a resource that we give you. We do it on the machine so that, again, it's a very calm and peaceful place, but by doing it on the machine, it really installs it into your brain so that if you go there at the end of session and we need to bring you back down because we don't want you walking out, then you have that resource. And then we do the outline.
So do you wear something or?
Yeah, that would be usually the second session. So you do wear something. So we have headphones and we have tappers. There's various things that that we can use. There's also in the tappers, there's a light. So some people choose to follow the light and some people choose not to. But it doesn't hurt. There's no radiation. There's nothing like that. There's no side effects regarding that. The most the side effects might be is, some people will report they feel a little more sensitive that week. They just feel a little more sensitive. The reprocessing lasts in the brain from 5 to 7 days. So you may have vivid dreams. That's very common. If you don't have vivid dreams, it doesn't mean that it's not working. But some people have very vivid dreams with it. Not nightmares, just more like very colorful dreams that they remember and they think, wow, I haven't dreamt in a long time. So that's very common. They can be a little more sensitive to things. That's very common as well. But usually after the first session, people start kind of feeling a little bit different. Things just don't bother them the same anymore. Yeah.
Are you sitting like in a chair in a room, or are you in an enclosed?
No, you're sitting in a chair in the room across from us. It's very safe. In fact, I have in here a picture of me doing it for
Is there vibration or music or sound?
There's vibration in the tactile, the hand paddles that we give you, and then there's sound there's corresponding sound to the right and left hemisphere of your brain with the audio headphones. But it's just a little beep. It sounds almost like a hearing test would.
Uh-huh.
Just that little beep.
Oh, interesting.
Yeah.
You mentioned sensitivity is increased. Is that emotional?
Yes.
Sensitivity?
Yes. So sensitivities can increase. Some people, though, right away feel just lighter. But some people say, yeah, I might have been a little bit more sensitive with my husband or so forth. And if that's the case, I always tell people to prepare their loved ones that is a possibility the first week or so. So just to be prepared. Yeah, maybe they might be teary-eyed more easily or something. But yeah, good questions.
You say it is treating trauma, which implies an event, a singular event. Is this technique also useful in treating a reaction, for instance, to, I'm talking about myself, but anger?
Sure.
I have this, I don't do anger. I do not, run away as much as, and I try to be an adult about it, but, but it's basically,
Right.
I can't do anger.
Absolutely. So if you were to come in, or somebody that had and I've actually, that a lot of people feel that way, we would work on, we would probably go back and check into, okay, where does that lie? What happened? My guess with somebody walking in would be, there's somewhere in the childhood there was a real, and that has left that memory into your brain. And we're all very good usually at kind of closing the door, sweeping it under the rug until it starts rearing its ugly head. And what that looks like is, again, disease, alcoholism, substance abuse, you name it. Men typically, I see more substance abuse issues, just typically. With women, I see more depression, anxiety disorders, anger, road rage, weight gain, depression, isolation, that type of thing. So that's typically kind of how things start surfacing. But that's what we do. We go back and we say, okay, where did that happen? And then we reprocess that. And it's very interesting how it just lifts. Where you'd walk in, an example would be somebody would walk into a room that previously felt that way, and they would say, wow, that guy's yelling at that other guy. That doesn't even faze me. And that's
if
the
he's yelling
true
at
test.
me, that would be the test. I don't care yelling, then I'd like, oh, whatever.
Right. So somebody might yell
Don't
at you.
yell at me.
Yeah.
I'm leaving.
Yeah. So yeah, good question. But it doesn't have to be a single trauma. More people
it
than
doesn't.
not come in for not single traumas, just for feeling down. They just don't feel like themselves anymore. They're just, they're not themselves, and they want their old selves back. Or anxiety, that's usually, and then with the outline, we pinpoint exactly what we're gonna work on, where it started, and so forth. So, And in the magazine, in the article with the picture with my son, it does explain a little bit more. It was an article that I wrote a while ago. It does explain a little bit more about exactly kind of what trauma is, and it's a pretty easy read. It kind of explains it a little bit more. There's a lot of research online about EMDR. Some people, I think, you have to go to somebody who has a lot of experience doing it. You don't want to just go to somebody who learned it and never uses it. Because there's different things you can do with EMDR when people get stuck, or I've heard a lot of people don't follow the protocol, and that's something that I do. I always follow the protocol, and it's important to follow the protocol. It was developed and written for a reason. So if you just throw these things on people and just say, okay, come up with something, it's not the same. So that's important.
Does the effect of a treatment work for a lifetime, or is that to be?
It does if you follow through the.
If it's done properly.
Yep, and you have to follow it through. So some people, what we see is that they start feeling better, like an antibiotic, and they stop. They say, I don't really need to come anymore, I'm feeling much better, but we didn't do the last part that we planned to do, and then it comes back. So it can come back. Yeah. Does anybody else have any questions?
So how many people do you see regularly?
I work 3 days a week. Right now I'm trying to scale back a little bit, and I have usually 12-hour days. I see people usually back to back. Yeah, people kind of seek me out for the EMDR treatment. They kind of come to our office for that. There's 3 of us in the office, and we all do EMDR. But it's really effective, and I think once they tell a friend and that's kind of because they see this person responding and reacting so differently, and they say, what are you doing? And that's kind of how it spreads. So, which is wonderful because it's a blessing.
Where is your office?
We're located just, right now we're just south of Shea on Hayden, in between Shea and Mountain View, on the west side of the street. A little street called Morgan Trail. It's right
I know
behind
where
the
it is.
church.
Sure.
We'll
There's a
be.
physical therapist right down there, too.
Is there? There might be. In about 2 months, we'll be relocating to 84th Street in Shea. It's just over into Sundowner Ranch over there, right near the 101 and Shea. So we'll be in an office right over there. But yeah.
Do you work with kids with ADD, ADHD, which is probably maybe a symptom of something else?
We do. Yeah, we have quite a few kiddos that have that. In fact, my own son has ADHD, and so I have done the EMDR with him, and I think it's been very effective. So it's effective for it's effective for experiences that may stem from most likely the ADHD. So if the ADHD doesn't usually come from a negative memory or a trauma. But a lot of negative memories and traumas happen because of the ADHD. So the child can't focus in class. They're constantly getting in trouble with the teacher. Their self-esteem goes down. They're impulsive, and they're handsy with other kids, and kids don't like that. And so then they have this belief of, I'm not good enough. Oh, wow, my son has told me just as much, which breaks your heart as a parent, but right away I'm like, let's get on this. With kids, it is so effective. Couple of sessions, it's like that. Their little brains are like little soft sponges, and the EMDR works amazing on that. He was coming home telling me that he was the worst kid in the world. Some kid at school told him he should die, which as a parent, you hear that, and I just, right away, let's do the EMDR. So now he knows. He's like, Mom, I think I need a little bit of EMDR. He's 7.
Wow. So same with autism, Asperger's, that type of deal, or?
It can. If there's, it depends on somebody's level of functioning. So if it really depends. So I do have quite a few clients that have Asperger's and autism, and we do EMDR, and it's for those memories that come up that start wearing away, that I'm different, and nobody wants to be my friend, and so forth. We do other types of treatments with people as well, such as social skills development and, awareness of themselves and that type of thing as well. Yeah, great questions. Any other questions before I pass it over to the lovely Valerie? Okay.
Thank you.
All right, thanks.